Okay, I want to show you guys how I program for helping somebody with low back pain. The first thing I do is dive into your mechanical stressors. I have ways of finding out what positions your back can tolerate and what positions it can't tolerate. Once we figure that out, we start looking at lumbopelvic control. If one of your mechanical stressors is an extension sensitivity, we start really making sure you know how to control your pelvis and get your back out of that extension position just by performing a pelvic tilt. This can be done laying down, this can be done sitting, it can be done standing, gives you a lot of relief from your lower back. It's the opposite if you have a flexion sensitivity. Then we learn how to do maybe a little anterior tilt, get you out of that flexion position. It's just as the same thing as if I had my wrist bent like this and it's painful right here. It's just as little bit of motion decreases the pain significantly. Well, that's the same thing we're learning with your back. That's the functional range then. All right, the functional range becomes how much can you move in that range without having pain. When it's acute, it's going to be a small range. As the nerve root desensitizes, starts feeling better, that inflammation gets out of there, your range is going to increase even more. So you'll have more range within that functional range. Once we learn all of this, then we start learning how to stabilize. So if you have a extension sensitivity, I start teaching you how to stabilize in anti-extension positions. If you have a flexion sensitivity, I start teaching you how to stabilize in anti-flexion positions. This is going to carry over to your activities of daily living and functional movements, right? So something simple like reaching up into the cabinet. You learn how to tilt your pelvis, you learn how to squeeze your glutes, brace your core, so you can reach, put things up in the cabinet, you have no pain. Once we can get this down, then we start moving into the fun stuff. This is where the magic happens with exercise. You start learning how to find your functional range during a deadlift. You're going to make significant gains with a decrease in pain. You're going to be able to hit those PRs. You're not going to have back pain. So this is pretty much how my programming works when I'm working with somebody with low back pain. I just wanted to outline it for you so you guys have a better understanding of what I look at.